People with dementia are at a high risk of developing delirium. Delirium is a medical condition causing a person to become confused, disorientated, and unable to concentrate and to experience fluctuating levels of consciousness. Delirium usually comes on very suddenly. As well as people with dementia, there are other groups at risk. People over 65, people with more than one health condition, people with sensory problems, people dependent on others for their care, people with depression, and people who have had recent surgery. The more groups a person belongs to, the higher the risk of developing delirium. There are 3 types of delirium: hyperactive delirium, hypoactive delirium, and mixed. Hyperactive delirium is characterized by agitation, confusion, hallucinations, disorientation, poor concentration, and challenging behavior. Someone with hypoactive delirium may be confused and disorientated with poor concentration, but they will also be very lethargic, sleep excessively, and be in low mood. In mixed delirium, the person will have alternating symptoms of hyperactive and hypoactive. Delirium and dementia have common symptoms but are not the same. Delirium can be treated, so it is important to be able to distinguish between the two. Delirium comes on very suddenly, over hours or days, and symptoms fluctuate. Another key feature of delirium is that levels of consciousness fluctuate. Delirium has really poor outcomes for a person with dementia. The key to managing delirium is to spot it early, using a person-centered approach. Understanding the individual and their usual behavior will help us spot when there is a change. Remember, change is an indicator for delirium. Causes of delirium can be identified using the acronym PINCH ME, where P is for pain, is the person in pain? I is for infection, has the person had infections before, could they have one now? N is for nutrition, has there been a recent change in their appetite? C is for constipation, another common cause of delirium. H is for hydration, is the person drinking enough? M is for medication, have medicines been started or stopped? E is for environment, have there been recent changes in how the environment looks, sounds or feels? Pinch Me can also remind us of things to concentrate on every day to help prevent delirium. Make sure pain is treated effectively. Making meals and drinks appetizing, available and using social interaction to help people enjoy food and drink. Introduce exercise, where the person is able, to improve their social environment and help with constipation. Review all medications regularly. Thousands of people are living with dementia, and thousands of us who are close to them and supporting them can make their life better if we know about delirium, how to spot it and how to prevent it.